Good day everyone. This video is a presentation of concept paper for final project on English for academic and professional purposes. Hi, I'm Hannah J. Kabakungan and I'm going to present the concept paper about high compensation for Filipino health workers to sustain sufficient medical staff in the Philippines. Our agenda will be the introduction, need for the study, background, objectives, research questions, methodology, research timeline, and reference. As an introduction, it introduces the condition as well as the problem that medical health workers are going through in the Philippines. As we all know, we are in the shortage of medical staff or health workers here in the Philippines. The reason is either most of them are moving abroad or they are unemployed due to the lack of opportunities. The main reason of shortage is their salary that is really not equivalent to the work they have done. Until now, Filipino nurses, medtechs, and other medical workers get the lowest salaries in Southeast Asia. For the need for the study, because of this pandemic, the national government is in the process of hiring more healthcare workers to augment the country's workforce. Only this pandemic will finally put pressure on the government to improve work condition of our healthcare workers. Before this pandemic, there is more than 200,000 unemployed nurses in the Philippines due to the lack of opportunities, while around 19,000 leave each year to work abroad. The pie graph shows the Philippines produced nurses from 2012 to 2016. It shows that 74% of that nurses moved abroad during the same period, and only 26% of that nurses remained in the Philippines in that period. For the background of the study, several studies have concluded that medical compensation and opportunities is the main problem on the situation on the Philippines. According to Japan Times 2020, fewer Filipinos are entering the field after hearing about its downsides. States and major private hospitals can offer starting salary of about 25,000 pesos a month, but in the provinces, pay can as low as 3,000 pesos to 6,000 pesos. Nurses cannot even afford their own basic needs, much more of their family's basic survival like food on the table, basic education for siblings and or children, medical expenses of elderly parents, and decent housing. For objectives, the research paper seeks to achieve its general objective of hiking compensation for Filipino health workers to sustain sufficient medical staff in the Philippines by focusing on the following specific objectives. 1. To determine what the government can do in order to provide better opportunities and compensation on medical health workers. 2. To determine what are the factors that influence the medical health workers to work abroad rather than staying on motherland. 3. To determine how the Philippines will sustain sufficient medical health workers. For the research question, it is based on the research objectives. 1. What are the government can do in order to provide better opportunities and compensation on medical health workers? 2. What are the factors that influence the medical health workers to work abroad rather than staying on motherland? 3. How does the Philippines will sustain sufficient medical health workers? For the research methodology, the study intends to use descriptive survey design in determining the reason why most of the medical health workers work abroad. The study will also do some interview on the government officials on Department of Labor and Employment and Public and Private Hospitals Association in the Philippines to determine how the government could provide better opportunities and compensation on medical health workers in the Philippines. This study will sample 20 hospitals, 10 in public and 10 in private, on both province and city in the Philippines. The study will collect both quantitative and qualitative data. Quantitative data will analyze using descriptive analysis, which will include range, minimum, maximum, and frequency, while the quantitative data will undergo content analysis. Minimum. The relationship between independent and dependent variable will be explained with infographics. For the research timeline of the study, the project is expected to be completed in 21 weeks, with the following indicated as the activity's duration for every section of the research project to be 1 week for title, 1 week for introduction, 2 weeks for the need for the study, 3 weeks for background, 1 week for objectives, 1 week for research question and hypothesis, 5 weeks for research methodology, 4 weeks for data analysis, interpretation, and discussion, 2 weeks for summary, conclusion, and recommendation, and 1 week for reviewing work for final submission. For the last part of this presentation is the reference. This is the reference of my concept paper. And this is where my presentation ends. I hope I give you enough knowledge about my concept paper. I'll try my best to answer all your questions.